Hello, my name is Jordan. I'm going to be your nurse today. First, we're going to start out with checking neurological status with orientation questions. Can you tell me your name and date of birth? And we'll check it against her hospital band. We're not at the hospital, so she don't have a hospital band, but tell me your name and date of birth.
Allison Nelson, January 30th, 92.
Okay, that checks out. Can you tell me why you're here today?
For an assessment.
Okay. Can you tell me where you're at?
St. Mary's in West Virginia.
Okay, who's the president?
Joe Biden.
Okay, and what year is it?
2021.
Okay, so those questions there she answered, they all check out. The name and date of birth was correct according to the band. Joe Biden's president. Okay, we aren't at St. Mary's, but I told her to say a hospital because we're supposed to be in a hospital setting. So that checks out. It is 2021 as well. So then we'll go get a set of vital signs. That includes pulse oximetry, heart rate, she has black nail polish on, so it might not take, but we'll see. Temperature and blood pressure. Now, while this is taking her blood pressure and her temperature and the other readings, the pulse oximetry and the heart rate, I'm counting her respirations. I'm letting her kind of relax. Okay, 98.4, which is normal. Respiratory rate's about 16. Heart rate is 68, and her O2 saturation is 97%. Just waiting on the blood pressure to finish its 133 over 83. So we're good there as well. So we would put all those in the chart. And then we would continue asking her other questions such as how tall are you?
5'6".
And how much do you weigh?
1'7".
Okay. So we'd enter those into the chart. And then we can compute a BMI. And based off the BMI, we could tell if her body type is underweight, correct weight, obese, morbidly obese, or whatever the BMI says. Next, we're going to conduct the head to toe. Your head to toe assessment starts at the hair on the head all the way down to the toes. So we would start with performing hand hygiene and donning some gloves. We would move to the head. We would take her hair out of the bun in a real assessment. We would feel around the skull, see if there's any bumps, indentions. Are there any tender areas? Ask the patient. No tender areas. And with the hair being down, we would look through the hair to see if there's any missing hair, sudden, abrupt, missing circular patches of hair. Could be a condition called alopecia. We would check for that, and we could also check for infestations of lice, bed bugs, or anything else. Nothing there. I don't note anything. There's no pain. There's no infestations. There's no missing hair on the scalp. So then we could go and conduct the rest of the assessment on the head. We'll start with testing some cranial nerves. We'll start with cranial nerve 7, which is the facial nerve. You conduct a test of this by having the patient close her eyes and open her eyes. So can you do that? Do it one more time. Good. So that nerve is intact. Next, we can move to the trigeminal nerve, which is the most complex nerve of the cranial nerves. There's 12 cranial nerves. This is nerve number 5. I'm not going in order from 1 to 12. So the trigeminal nerve is the nerve. It's a motor nerve that conducts chewing and biting. So you would have the patient bite down. All right, and you feel those muscles on the jaw contracting, so that nerve is also intact. Next is nerves 3, 4 and 6, the ocular motor nerve, the trochlear nerve, and the abducens nerve. Those are all kind of tested the same. We're going to do a series of tests here to see if they're all intact. I'm not going to stop and identify each individually because they all kind of work simultaneously. So first we're going to have the patient using a pen light. Look forward, have her look forward, and just follow the pen with her eyes. And when you're doing this, you want to make sure that there is no nystagmus, involuntary movement, jerking of the eyes. You want to test all 6 fields of vision, and that is intact. Okay. Next, you want to look. A typical eye is 3 to 5 millimeters in diameter. The pupil is, so you want to look. Her eyes are about a 3, so you'll take your pen light. Just look at my nose, and you should see them contract. Both of them contract and dilate together. Good, there you go. So that is intact. There is no jerking, involuntary movement of the eyes while she was moving her eyes. So next we'll check accommodation, make sure there's accommodation in the eyes. So when you're checking accommodation, you'll have the patient, you'll take a pen light about 12 to 14 inches from her face, have her, or him, in this case her, concentrate on the tip of my pen light with both eyes, and we're going to move it closer. And what you should notice is the eyes begin to cross and her pupils start to constrict as the object gets closer, and it did. So we're intact with all of those nerves. Next, we're going to feel the mastoid process behind the ear. No tenderness. Is there tenderness?
No.
Okay. And what we'll do, I don't have a tongue blade, so we're going to just use the thermometer. We're going to have the patient open her mouth. All right, and we're going to compress down. The uvula is nice and round and dangly. It's not beefy red. The tongue, stick your tongue out again. It comes out straight. It doesn't go to either side. It's nice and moist and pink. And open up. You would take a tongue blade and you would check, make sure there's no beefy red spots in the cheeks or gums, no dental caries. And then you're going to have the patient stick her tongue out again. Take it to the roof of your mouth, like that. Take your tongue and push it against. And we want to push down on the teeth and look at the floor of the mouth, because there can be ulcers here or tumors. That's where mouth cancer likes to hide, is under the tongue. Open up again. And we want to check the hard and soft palates of the mouth again. Make sure there's no deformities there. And the last thing we would like to do in the mouth is stick your tongue out and say ah. Do it again. Okay, and you want to make sure the uvula goes up when she does that, and it does. All right. So I also don't have an otoscope, I'm sorry, but you would take, we want to look at the external ear. Make sure there's no deformities, pain, there's no exudate coming from the ear. You would take the otoscope. On the left ear, you would have it at 7 o'clock and look in with the light. Make sure the internal structures are good, and on the right ear, you would have it at 5 o'clock. Make sure all the internal structures are good. Some patients, as you see, well, on this side, some patients in general, they'll have the tragus piercing, and she does. So we could note that just to make sure, because that could be a source of infection. It seems like she's had it for a while, so obviously it's not. Next, you want to look at the nose. Make sure the external portion of the nose is good. There's no deformity. She also has a piercing here. Look, you would want to look up, take your pen light, make sure the septum is nice and midline, it's not deviated, and look, make sure there's no deformities or drainage or anything in the nostrils, and hers are also clear. Next, you want to feel, make sure that the tonsils are not swollen, and they're not. You would also be able to note that on the inspection of the mouth. And so that conducts the head. Next, we'll move down to the neck. You would want to look at the neck, which I guess that's kind of the neck, but you want to make sure there's no lumps around the trachea, because you could have those in some conditions like goiter. You have a big goiter lump. She does not have that. You want to palpate the C-spine here for any tenderness. Is there any tenderness?
No.
No tenderness. Can you move your head left to right? Any pain?
No.
No? Can you move it up and down?
Yes.
Any pain?
No.
Good. Can you shrug your shoulders? All right, now I'm going to push down. Can you shrug your shoulders? Good. Equal strength bilaterally, so we would note that in our assessment as well. And next we're going to move to the thoracic area of the assessment. So let's start with, we're going to start with inspection. So she has a shirt on, restricted somewhat of what I can see, but I see there's symmetry here on breath. Breathe in and breathe out. So there's equal, her chest move is symmetrical on both sides. You want to feel her back, her upper back here. Any pain?
No.
You can feel the upper thoracic vertebrae for any deformities. Make sure that those are midline as well. Any pain?
No.
No. Okay. You would want to feel the upper chest. If there would be any subacute air, you could feel crepitus in this area. Any pain? And the clavicles here, feel those for symmetry throughout, and they are symmetrical. So next, I'm going to listen to her breath sounds. Deep breath in. So she's clear throughout. So as you see there, I went top, 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 top. Some nurses do all frontal and then the back, and I don't. I want to listen to the front, the upper lobes first, anterior and posterior, and then I'll listen to the bases, anterior and posterior, or like I did here, posterior and then anterior, just to make sure that all the lobes sound similar. And she did. There, she's clear throughout. Next, we'll listen to heart sound. So you should hear the S1, S2, which is like a lub-dub sound, which I did. Listen here, the apex, the apical heart rate would be mid-clavicular line, the fifth intercostal space, which would be about right here, right under the the breast of the patient. That's the loudest point of the heart sounds. Okay. Next, we'll move to the abdomen, and we'll conduct an abdomen assessment. Now, I don't have a table. We're not going to lay on the floor, so we're here on a chair. So we'll start with the abdomen is different as to you would want to look. So you look, okay, but do not palpate until you auscultate. Palpation of the abdomen can throw off your bowel sounds and make them either hyperactive or hypoactive compared to what they normally are. So I look, there's no bruising, on the front. On the back, we'll look at the trunk. There's no bruising back here. So we don't think of any injuries. Are you having any pain?
No.
No. When was your last bowel movement?
Yesterday.
Do you normally go once a day, every day, once every other day? Once a day, every day. So it was yesterday. Okay, so there's still time today. So we'll say she's regular with bowel movements. How's your appetite?
Good.
Good. All right. Have you noticed any unexpected weight gain?
No.
Weight loss?
No.
Okay. All right. Now, I'm gonna listen to the bowel sounds. And we are normoactive there. Next, you just want to feel any distension, tender areas over the abdominal cavity. And I wouldn't really be able to do it, but you would be able to percuss. But where she's seated like this, and she has these high-waisted shorts on, I'm not going to be able to get a clear sound on percussion. All right, so next we'll move. We're going to feel the hips, make sure they're nice and sturdy. There's no pain. Pain?
No.
No. Okay. There's no give either way. It indicates a nice sturdy. There's no pelvic fractures or anything like that. Next, we're going to check reflexes of the lower extremities. So if you could just let your feet dangle. I'm just going to take the bell of my stethoscope here. Okay. Good. All right. Now, reflexes are good. Now that we're on the peripheral, I'm going to come back and do arms. If you notice, I skipped those. I did central, and now we're going to check pulses. I'll say her radial pulses are a 2+, and we'll do brachial pulses. That one's also nice and strong, a 2+. Also, a 2+ on that brachial. All right. Okay. Relax for me. Okay. Next, we're going to check the strength of her lower muscular skeletal system. Can you pull back with your toes? Good. Can you push down with your driving? Good. Now I'm going to push down. Keep me from pushing your leg down. Good. Now push up against my hand. Good. All right. Now when we do this one, we're going to check strength on both sides. Pull back. Good. Push. Good. Keep me from pushing you down. And push me up. Good. All right. Now we can move back and we'll check. And we're going to check pulses in the leg. We'll check the popliteal pulse, which is nice and strong, 2+. Pull the sock down a little bit. Identify the dorsalis pedis, also strong, a 2+. And we'll do it on both feet.
And we're 2+ on both of those. Now also you want to note skin color. She's nice and pink. There's that. It could be, if she wasn't, that could be an indication of any type of vascular problems. Her cap refill looks good. Her gums were nice and pink. Cap refill, she has fake nails on, so what could we do? We could turn it over. The tips of her fingers should also be pink, so we could just squeeze those. It blanches white, and it refills less than 2 seconds. We would do that with her toes as well. And then to check her plantar reflex, we could just take our pen light, and so she's pretty ticklish. Obviously it's there, and just pull it up the foot, and it would make her want to jerk away from the stimuli. Okay, so that conducts our head-to-toe assessment. Thank you, Nursing Class 320, and I hope you found this video educational.